as Sir has rightly mentioned, I am coming from very small town, and with the blessings of God, 3 books written by me is recommended in RCOG material. These are the few credentials of mine. And today the topic given to me is difficult hysterectomy. For difficult hysterectomy, in my first book written in 2000, Hare Sai, with the blessings of Sai, everything is there. So pray to Almighty. God Sai and Gurudev is always with us to share their blessings. This is my umbilical technique. You can see and you can palpate umbilicus here. Always in any difficult situation, any previous surgery, it is required that you instill xylocaine before putting any port, either 10 mm or 5 mm. Post-operative pain will be reduced and there is less bleeding, and the pain is also very less. After instilling it, always try to make a habit to see umbilicus carefully. Put Alice's forceps into the umbilicus, and you can see there is Langerhans line already there. So put a straight cut over this Langerhans line, and you can lift both the edges of umbilicus. And with the edges of umbilicus, you can see that umbilicus is such an organ that all the layers are stuck into it. Just put your artery forceps and open it. This is an open umbilical technique. You can see there is a direct port. You can put your trocar in, and within less than 1 or 2 minutes, you are directly into the abdomen. You can see floating intestine and everything is there. Now you can put gas on. My first case is of previous cesarean section. In always you can see mental adhesions are there near the umbilicus, but never these adhesions are seen onto the umbilicus. I always using 2-port surgery because I am coming from small town. There are no good assistants available, so I train myself to do surgery with 2-port only, 2 ipsilateral or 1 ipsilateral and 1 central. This is surgery in which we are going to remove these adhesions. These are tomental adhesions of previous surgery. Here bipolar and vessel sealer are very good to see, cut the things very easily, and once ever when you see some bleeding, use bipolar energy source to cut it. After cutting all this adhesion, you can see there are multiple fibroids are seen into this uterus. You can see there are multiple fibroids with previous cesarean section. Always follow all the principles of open surgery in a laparoscopic surgery. Always follow it. Always follow the all principles are of open surgery into the laparoscopic surgery. Always remain very much near to the cornu. Use the judicious use of your surgery or the instruments which you are using. First clamp is always near to the cornu. If you want to remove this ovary, never place first your clamp to the infundibulopelvic ligament. It is always near to the ovary, and always do the sandwich technique. First coagulate on the medial side, then lateral side, and then in between, and then cut your veins with this sharp cut at the level of tubo-ovarian ligament and round ligament together. Always try to separate or skeletonize uterine artery. This is a posterior peritoneum separation from here to here. Used bipolar current. Once you see small oozing or bleeding, try to catch it and cover it with bipolar forceps. This is the area from which we have to cut the bladder. As this patient has got previous cesarean section, you can see there are adhesions, but it's not too much stuck. So we can go easily and we can cut this bladder. You can see this is a bladder bulb. This is a base of bladder. Vessel sealer is beautiful instrument. Previous 2 speakers had also used this instrument beautifully, and it has got cutting sleeve it with. So coagulate it and cut it. This is my technique of putting probe into the scope into the hot water. So whenever there is fogging is there, they use thermos to filled with hot water, and just put your scope in, and you can gently go in to separate the bladder easily. These are the bladder pillars. Always have a good patience on your patient to do good laparoscopic surgery. If you see, there is good wordings by Leo Tolstoy that 2 most powerful warriors are time and patience. So if you want to get good result, always utilize your time and patience on your patient to get good result. Always try to cut this as we are doing in open surgery, very slowly, and if you cut it on a proper plane, you see there is very less bleeding and oozing. So try to cut this pedicle from one end to the another. Same way, do the first clamp just you are doing in open surgery. One tag, second tag, and third tag. This is called a sandwich technique, so you don't have